Hi, good morning. My name is Crystal. I'll be your nurse doing your head to toe assessment this morning. Just finished washing my hands. Will you please confirm your full name and date of birth?
Kimberly Gutierrez, September 9, 2006.
Any allergies?
No.
All right, are you experiencing any pain today?
No.
All right, and do you know where you are?
Doctor's office.
Today's date?
March 18th.
Okay, and our President of the United States?
Joe Biden.
All right, patient-oriented ×4. Prior to me coming in, the CNA took your vital signs. Everything was within normal limits, okay? We're gonna go ahead and get started. All right, so I'm gonna start with your head first. I'm just gonna part, make sure there's no color abnormalities, no lesions, no scratches, rashes. Everything looks great. No tenderness, correct? I'm gonna go ahead and look at your ears. All right, tympanic membrane is gray, translucent, no foreign body and ear canal, minimal serum present. I'm gonna go ahead and look at your nose. All right, no visible polyps, abnormalities. Everything is pink and moist. Go ahead and open your mouth for me. All right, oral mucosa is pink and moist. Uvula is midline. Tonsils are a 0. All right, I am going to go ahead and just start with your neck. All right, temperature is warm. Trachea is midline. No visible scars, lesions, rashes. And if you'll turn that way for me, I'm going to go ahead and palpate your thyroid. I'm just going to move it over and palpate with my left hand. All right, go ahead and swallow for me. All right, no palpable nodules or goiter. I'm gonna go ahead. I would be having my patient laying in a 45-degree angle. No jugular vein distension. All right, no visible jugular venous distension. I'm gonna go ahead and check your lymph nodes. So it'll be our pre-auricular, post-auricular, occipital, our tonsillar, submandibular, submental, our supraclavicular. Go ahead and roll your shoulders forward for me. Okay, great. All right, relax. Anterior cervical, posterior cervical. Okay, no palpable nodules, which is normal. Okay, I'm going to go ahead and just assess your carotid pulse. All right, 2+ normal. Okay, I'm going to go ahead and listen. No bruits auscultated, and I'm going to go ahead and check your pulse with your apical. All right, even tone, everything's great there. All right, I'm going to go ahead and move on to your chest and your arms. Temperature is warm, or actually your cranial nerves. I'm going to go ahead and start with cranial nerve 1. Occlude one nostril for me. What do you smell? Okay, go ahead and do the same thing on the other one. What do you smell?
Oranges.
All right. Cranial nerve 1 intact. Prior to me coming in, the CNA did perform your vision test, your Snellen chart test, and vision is 20/20, which is within normal limits. I'm going to go ahead and test for cranial nerve 3. Just look straight ahead. All right. Pupils are equal, round, reactive to light, and accommodating. I'm going to go ahead and test for cranial nerves 3, 4, and 6. 6 cardinal fields of vision. Follow my pen. All right, no nystagmus present, extraocular muscles intact, cranial nerves 3, 4, and 6 intact. I'm going to check cranial nerve 7. Go ahead and puff out your cheeks for me. All right, squint, raise your eyebrows, smile with teeth. All right, now I'm gonna test your TMJ. Go ahead and open and close, open and close. All right, cranial nerve 5 and 7 intact. Gonna test for cranial nerve 8. Go ahead and close your eyes for me. I'm gonna say something if you'll just repeat after me.
1, 2, 3. A, B, C.
All right, good job. Go ahead and stand up for me. And close your eyes. All right, minimal swaying. Go ahead and sit down. That was our Romberg test. Cranial nerve 8 intact. Now I'm gonna check for cranial nerves 9, 10, and 12. Go ahead and drink for me. Well, before you do that, let me check something. Okay, gag reflex intact. Okay, swallowing good. Go ahead and stick out your tongue. Move it side to side. All right, cranial nerves 9, 10, and 12 intact. Go ahead and shrug your shoulders for me. Relax. Shrug your shoulders again. All right, good job. Cranial nerve 11 intact. Now I'm going to test your upper and lower motor neurons. So if you'll do this for me and put your hands around. All right, and do your heel to shin. Okay, all right. Upper and lower neurons intact. And I watched you as you walked in. Gait and balance is normal, no limping, no ataxia. Now I'm going to go ahead and move on to your chest. All right, skin is normal color, no lesions, no rashes. Thoracic cage is symmetrical. Musculature is within normal limits. Clavicle is symmetrical on the front. Sternum is midline. If you'll go ahead and turn that way for me. All right, scapulas are symmetrical. Vertebrae is midline. And then go ahead and stand up for me. Okay, and turn this way. I'm just going to test your lung expansion. Go ahead and take a deep breath. Exhale. One more time. Exhale. Okay, go ahead and have a seat. Lung expansion is symmetrical. Breathing is unlabored and normal and unlabored, I believe. I'm going to go ahead and listen to your heart. All right. Aortic valve, second intercostal space, right sternal border. S2 greater than S1. Pulmonic valve, left sternal border, second intercostal space, S2 greater than S1. Erb's point, third intercostal space, left sternal border, S2 equal to S1. Tricuspid valve, fourth intercostal space, left sternal border, S1 greater than S2. Mitral valve, mid-clavicular line, S1 greater than S2. Fifth intercostal space. Okay, lean forward. And I am going to be doing your pulse here at the apical site for 60 seconds. All right, and that's going to be heart rate of 70. All auscultation was done on bare skin. I'm going to go ahead and listen to your lung sounds as well, okay? So when I put it on, just take a deep breath in and exhale for me. All right, on the right side, I'm going to check laterally 3 spaces since we have 3 lobes. Deep breath. Okay, on our left side, laterally, I would check 2. Deep breath. All right, go ahead and turn that way for me. On our back, I'm just going to check. Deep breath. No wheezing present, no crackles, no abnormalities. What we're gonna go ahead and do is I'm gonna do your pulses bilaterally. So I'm gonna check your brachial pulses bilaterally. All right, that is a 2+. Radial. That is a 2+, which is normal. Let's do your capillary refill. Less than 3 seconds. Less than 3 seconds. I'm going to test your deep tendon reflexes. Just relax your arm for me. Okay. Relax your arm for me. Just relax. Okay. Arms down here. Just flex for me and relax. And flex for me and relax. All right, go ahead and just relax your arm here. Okay, a little bit more time. All right, deep tendon reflexes are within normal limits. Now, when was the last time you had a bowel movement?
Yesterday.
Okay, any abnormality in color, texture, consistency? No? Okay, any painful urination, blood in urine?
No.
Okay, great. Go ahead and lay down for me. Yeah. All right, patient would be bared skin, and if not, I would lift. I am first going to inspect. No lesions, no abrasions, no rashes, no visual ascites present. I am going to go ahead and auscultate. I would begin in the right lower quadrant. Right upper quadrant. Left upper quadrant. Right lower quadrant. Okay, I would listen to our abdominal aorta. No bruits auscultated. Okay, I'm going to go ahead and percuss. All right, I'm going to go ahead and palpate. Let me know if you feel any tenderness or pain. No. Okay. No. All right, go ahead and sit up for me. I'm gonna go ahead and just look at your skin color on your legs. Okay, skin color's within normal limits. No pallor, no erythema, no edema. And I'm gonna go ahead and I'm going to test your range of motion, so just kind of outward, outward, and then in. All right, lift your feet for me. I'm going to push. Don't let me push down. All right, good. And I'm going to lift. Don't let me lift. Okay, good job. Okay, 5 out of 5. Muscle strength is good. Let's do capillary refill. Less than 3 seconds. Less than 3 seconds. I am going to check your posterior tibialis pulse. Okay, there it goes, and it's back here so you can see on video. All right, and then flex your foot for me. Okay, relax. All right, pulses bilaterally are 2+, which is normal. I'm going to test your reflex, deep tendon reflex. Okay, and one more. All right, everything looks good. So let me get this information back to the physician and we'll be back with you shortly.